Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. He is currently in private practice and is the clinical director and co-founder of Psy.D Treatment, a young adult dual diagnosis treatment facility in West LA. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
I met with Dr. Joshua Mirmelli. We had a great time, despite some coffee being spilled and a little of some cheesy exercises to start our program. Dr. Mirmelli did a great job letting us know how to work with families and the importance of working with families of individuals who struggle with substance issues or individuals who have mental health issues, and how working closely with family can oftentimes help the individual and the family contend with very challenging issues. Hi there.
Hello.
Hi. We have had entertaining morning so far.
We sure have.
We started with our Wonder Woman pose.
Right.
An explanation of the research.
Yeah.
Of Amy Cuddy.
Yes.
And we were getting empowered. You've knocked a cup of coffee over.
Correct.
You've dropped a phone.
That's right.
And we're here.
And we were in the Wonder Woman pose.
And we just we're saying spilling's okay.
That's right.
Spilling is okay.
Spilling is okay.
Spilling is okay, and we move on, and we can still roll with this.
That's right.
So we're here, and I'm so grateful to have you. I'm reading this little background resume. Unbelievable.
And the crazy thing is most of it's true. I mean, my goodness.
I mean, so much extensive work with family. And as you know, I'm so interested in how people help people. Who's getting better?
Right.
Right. That's what's that's the focus here. And I want to talk to people on the ground who are helping people. And what you do is kind of interesting to me because we talk about the opiate epidemic, the substance abuse issues throughout the nation, throughout the world.
Yeah.
And we talk about the individual. And here you are, right? And you do work with individuals, but you also do extensive work with families.
Yes. So,
and I think it would be helpful for people to know, what on earth does that have to do with getting better if you're helping families?
That's right.
So I want to just hear about what you do, and just hear who is the type of family individual who walks into your office or to your workshops. What do they look like when they come in, and what does it mean? What does it even mean that they need to get better?
Right. Well, first of all, I just want to say thank you so much. It is an honor to be here. I did spill the coffee. I did feel empowered in the Wonder Woman pose, and it means so much to be able to be here and talking about family work. It's an amazing question that you ask. I think the family who walks into my office is one who is filled with terror, total fear about the process of active addiction, about the process of recovery, and to what extent they may have played a role in their loved one getting to the place that they have in their addiction. It's really terrifying for them to feel they played a role.
So they walk into Dr. Mirmelli, you're a doctor, you can help me.
Right.
Right? And I'm terrified. My kid has been out of control.
Well, and I think the scarier piece is you're a doctor, you can't help me. Who can help me? No one can help me. I've been in a place of agony and terror and just total panic that I'm going to lose my child, my son, my daughter, my loved one. Can anybody help me? Take this panic away.
So they want you to relieve their panic. Which one do they want? Do they want you to relieve the panic, or do they want you to actually help their kid?
I think initially, to be quite frank, they want to have that panic relieved. They're so devastated and totally stuck in this space of fight, flight, freeze, limbic zone, reptilian mind of, I don't even know what's going to happen. I don't know how I'm going to get through the day.
So they're not in Wonder Woman.
They're not in Wonder Woman pose yet. That is for sure.
They're not there. They don't have a sense of I can walk through this. They're panicked.
They don't feel like they're in the driver's seat of any aspect of their lives, let alone their loved one's addiction.
So what's so stressful prior to walking in? I mean, remember, a lot of people listening to this are going to be perhaps new to this.
Right.
For the average person who's not informed, just tell their kid to stop it.
Right.
So what's going on with this kid, this loved one? What's going on that's historically that's making them so panicked?
By the time most families walk into my office, they have been at the brink of total devastation and tragedy within their family system. They may have taken their loved one to the emergency room several times. They may have walked in on their loved one overdosing on drugs in a total space of life and death. And I think they are caught in that zone of total panic. And they have lost their capacity to have perspective. They've lost their capacity to feel empowered in their ability to set boundaries. They've just totally lost their framework for healthy living.
So here we are. I have it. Let's hypothetically, I have a child, son or a daughter, and my whole life is high alert.
Right.
I've dedicated my life exclusively to keeping a GPS internally on this individual, right? I live in a state of what's going to happen next.
Right.
And I'm waiting for the other shoe to drop, and I'm forecasting.
Correct.
I'm forecasting of I'm gonna make moves ahead of this kid.
That's right.
I got to make moves.
Right.
I got to do things to get ahead of the curve so nothing bad happens.
Totally. And beyond, I have to do things to get ahead of the curve of my loved one's addiction. I have to do things ahead of the curve of me having feelings that are uncomfortable to sit with, like the feeling of impending doom, the feelings of fear surrounding the possibility of my loved one dying. How do I sit with those feelings on a daily basis?
So I don't want to have that discomfort because it's terrifying.
Correct.
And it's true.
Right.
This loved one may die.
And that, in a nutshell, is the work that I really help families to focus on. There's such a mirroring process between the child, let's just say, who's in active addiction, and the family member from the standpoint of being so terrified of sitting with feeling. So terrified of sitting with feeling.
And the feeling, but the mothership feeling,
Yeah.
the big one is, the one that's the scariest is, my child may die. Right. That's the one that's the scariest.
Absolutely.
Secondary, they may not finish school. I've seen that before, right? Oh my God, what happens if they don't finish school?
Right.
What happens if they don't continue and get a job? Look at this is derailing this
What
individual.
do I tell people, right? How do I explain the course of my child's life? What will they think of me? What will they think of my parenting? How do I sit with the feelings of loss associated with my kid not being on the trajectory that I dreamed of them?
So I have to face the world.
Right.
And I want to get ahead of the curve. Not just that the mothership one, which is this child may die, but also the social one that you're talking about, which is interesting, is hey, what if people see my kid as a quote unquote fuck up, right? Because I had a whole idea of what this very bright individual with a lot of aptitude and potential was supposed to look like.
Right.
And how do I face the world saying, yeah, my kid's in his 9th rehab?
And how do I sit with the feelings that I might have been a fuck up as a parent, right? Did I fuck up? And again, that's a mirroring process because the individual in active addiction struggles with the same sentiments.
So I like to talk about what you're calling it a mirroring process, a parallel process. The child, in this case, the loved one who's in active addiction is chasing the drug.
Right.
And the parents are chasing the child.
That's right.
So they're both chasing something, and it's a full-time job for both of them.
Correct.
It's a full-time job for both of them, and you have these critical moments where ERs, getting kicked out of school, losing jobs, stealing money, right? These are all a day in the life of Dr. Mirmelli.
Yes.
Is my child just stole, $100,000 from me. My child just flunked out of school. My child is asking again if he can come home, right? And he's promising, right? You hear the word promise a lot?
Oh, yeah.
So big, sincere promises with no history of data to suggest that those words have any depth or meaning or reliability.
Correct.
Right? So this is who walks into your office and they're saying, please, I don't want to feel this way anymore. I want this to stop. So you're a doctor. Wow. So impressive. They're so impressive. You obviously, you're going to fix this because you're well regarded with such an impressive resume.
Right.
Right. So I come in and say, help me. I have to help this. We have to stop this. We have to get ahead of this.
Right.
So what do you say?
Well, I say, actually, I think we've got to get ahead of sitting with the sense that you've got to, mom and dad, fix these feelings. You've got to modulate your own discomfort in order to feel like you're capable of helping your loved one. So it's not about how do we fix your child? How do we learn to sit with the discomfort of urgency? How do we learn to sit with the discomfort of not responding to urgency? And again, it's a mirroring process.
Can I give you a good one?
Please. Oh,
It's not mine.
okay.
But I'm stealing it.
I'll take it.
We use it. We use it in clinic a lot. We don't meet urgency with urgency.
That's right.
We really want to reserve
Right.
urgency
Correct.
for true urgency.
Actual urgency from feigned urgency or from feelings of urgency is totally thwarted in early recovery, right? Their ability to know the difference between 911 and I broke a nail is really hampered, as is their loved ones.
I like that analogy.
Thank you.
911 versus a
Versus
hangnail?
The hangnail.
Right. So
Yeah.
they treat a hangnail like it's an emergency, right?
Right.
Right. Like, like the idea they're calling 911
Right.
for the hangnail.
You don't need Cedar Sinai. You need a French manicure. Right.
Right. So yes. So where to get intervention, right? And so part of what you're doing is saying this doesn't require a whole treatment team and team of people panel to deal with the hangnail.
That's right.
Right. But here's the challenge, though. Aren't they trained by their loved one that every 10th time it is an emergency? So I get why they're so panicked, right? I get they think maybe this time it will be the emergency. Maybe this time it will be the emergency. So everything feels like an emergency.
Right.
So how do you train them?
Well, I think it's time and it's separation from family members' drug of choice. And I say that really loosely, understanding and appreciating and respecting the sense of responsibility that family members feel for caring for their loved ones. In the same way that an individual in active addiction requires a period of detoxification from their drug of choice, I believe strongly that family members need to detox from their drug of choice, which is their loved one who is in the grips of an addiction where family members have learned to sacrifice their own needs to meet those of their child. And it's a really scary place to feel like all that I've sacrificed now doesn't matter, right?
How on earth does this land? This is so counterintuitive.
Totally.
You're saying to me that the family's mission, which is I got to be there for my child, even if I'm guilty that I haven't been there in the right way, I'm so worried about this individual. It could be a spouse too, by the way, for the purpose. It could be anybody, any loved one.
Right.
Right? So you're saying that the messaging is go against your instincts and your reflex, and instead of moving towards, create a detox.
Right.
I actually never heard that.
Yeah.
You need to go through detox.
Correct.
So you're going to start that parallel process discussion of what does a detox look for your loved one, and what is a detox going to look like for you, and what is a relapse going to look like for you?
Right. One of the things I hear more often than anything that kind of sends a really just chilling feeling down my spine is when family members say, how can I do that? I love my child to death. And one of the things I've seen more than anything is that family members, unfortunately, sometimes do love their kids to death. I've not seen family members boundary their children to death, but I have seen love and a family member's sense of what love looks like, being there no matter what, supporting their loved one unconditionally, land a child in the hospital or morgue.
So speak to that, because you're saying that it's a counterintuitive. Any parent listening to this, right, is having a reaction like, what do you mean? What do you mean? So what is your treatment plan that when they come in, what is the great help of Dr. Mirmelli is saying you need to separate, right? And then what does it look like? You're using words, big words like boundaries. You're using words like that.
Yeah.
Right? What does it look like to implement that, and what does it look like to relapse?
Yeah. Well, it's scary as shit. Can I say shit? You said fuck, so I can say shit.
I did quote unquote.
Okay.
And you didn't.
I didn't.
No, so I make it so it's not a natural. You said you're coming off as natural.
Almost too natural.
Yeah.
Okay.
Do quote unquote.
Okay. Quote unquote shit. Family members will say that, and I think for me, it's a modeling process, right? Family members look to me, whether they're asking for it or not, to model what it looks like to set boundaries with their kids. So family members mom and dad are so used to responding to calamity with urgency. My work is to teach them and train them to respond to calamity with a little bit less urgency.
So what's the phone call they get that is the hangnail?
The hangnail phone call is, my sober living doesn't have good food. They're starving me here. I need money toward my Postmates account now. There's an apartment and there's that's just been listed, and my roommate at sober living is moving out. If I don't hop on the bandwagon now, I'm going to lose this opportunity, and I'm not going to have him as my roommate, and he's really committed to recovery. Transfer money into my account now.
Feels kind of 14 to 16.
I would even say 13 to 15.
13 to 15, 13 to 7. It feels kind of teenagey.
It is.
It feels right, no matter what age they are.
Correct.
Right? So there's an urgency of their anger. So they could be met with anger.
Right.
What, like a threat? Where's the threat in that?
Well, the threat is, and if you don't, I'm just going to leave, right? You're going to totally affect the positive path that I'm on, and you're going to derail me. So I'm not going to my meeting tonight.
This may actually be in the detox phase of the parents.
Big time.
That phase where you're saying, take a back seat.
Right.
Do not engage.
Right.
So they get the urgent message.
Correct.
And you're saying to them, you need to back, quote unquote, the fuck off.
Correct.
Right? And you're saying you have to do this for you. And you're gonna get pulled in. You're giving them that heads up. You're gonna get pulled in. So they get the phone call of, I'm potentially gonna leave. The food sucks. There's no freedom in where I'm at, right? I hate this. And they honor it by calling you, and you say, what do you say to them?
What I encourage them to do is use the team, right? Say to your loved one, your child, wow, that sounds really uncomfortable. I would not want to be in your position, and I give you so much credit for walking through that. Who can you talk to at the Sober Living House? Can you call your sponsor? Can you get to a meeting? What skills can you utilize to take things down a notch? Because, wow, it sounds so uncomfortable to be in your shoes. When I'm uncomfortable, when I'm scared, here are some things that I do that are really helpful, right? Why don't we both practice implementing a skill and call each other back in 30 minutes? Honey, I gotta go now.
So there's a chance that this child, loved one, is sat in a meeting with a doctor like you. Yeah. And they're having the discussion of, here's the way we used to do things. Mm-hmm. Here's the way it's gonna look like moving forward. You gotta learn how to walk through this yourself.
Right. Right?
Just like I gotta learn how to walk through this myself.
Yes.
So they're gonna do it. So the parents call you, and they're all panicked because he or she may run out of the treatment center or run out. They don't have to be in a treatment center or a sober living. They can be at home.
Right.
They can be anywhere.
Right.
But there's some impending thing, and they call you, and you're like a healthy Xanax.
Right.
Right. You're like a healthy relaxer.
My goodness.
You're so calm, by the way. Everybody looking at him, he's in a, you don't have a video, but he's sitting cross-legged.
I'm sitting Indian style.
Indian style.
Shoeless.
Yeah. Calm.
Yeah.
Like a good relaxer.
Yeah.
So how do you take that down?
Well, I model it for them, right? So it will, I'm, by the way, I'm very much myself in session. So I typically wear shoes, but I sometimes do sit Indian style. And I model for parents what it looks like to take things from a level 10 to a level 7. And look, there are real true emergencies. There are real true crises. If everything is a 9, 10, and 11, then nothing is. So my work is to help parents ferret out what's vital, crucial, imminent, and what's just not.
So what is imminent? What's an example of imminent?
An example of imminence is your child's in the hospital about to die. Your child has left sober living, has left treatment, has been using for 3-4 days, and now picks up the phone and calls you and says, I'm willing to do anything at this point to get sober. I will listen to you. I will listen to the team.
So that's when you're saying to the family in that moment, those are critical moments.
Right.
Intersections that you may stumble upon
Right.
that could have depth and weight. Pay
Correct.
attention to those.
Right. The moment, and the only moment that I really tell parents to sprint is when their loved one is saying, I'm willing to do anything, whatever it takes to get well.
Right. What about when they're in crisis mode?
Mm-hmm.
The loved one is in a crisis mode. Call and they say, I'm having a hard time breathing, or there's some sort of, I had a car accident. Is that also a sprint moment?
It is a sprint moment. It's a sprint moment to 911. Right? Parents are not police dispatchers. Parents are not paramedics. And their adult child, most typically, who is in that 14 to 16 range, right, while very sophisticated in their capacity to be manipulative, really should be at home watching Hannah Montana, right? Mm-hmm. But the reality is, I think parents are so thwarted in their capacity to see real crisis from feigned crisis. And they have to model for their child what real panic looks like.
And also what my role is in it.
Right.
Meaning, why am I stepping in why am I always the cleanup crew?
Right. And what my role isn't.
Right. So I like what you said. You said, even if it is a car accident, I'll call 911 and I'll say you should go to the scene. Right.
Correct.
And I don't have to be on the front line of every single encounter.
That's right.
Because there's a contract, right? There's a contract in life. I have to show up to my life, right? And honor the commitments, or else, I don't get paid. I don't get to fulfill my obligations as a spouse, as a father, right? And all these things. But the contract of, I get to not have a contract and do whatever I want and know that there's going to be a soft landing.
Right.
Actually cripples someone.
Yeah.
Right? Just like a trust fund baby, right? Just like any individual who doesn't have the full weight of consequences knows that.
And it's so confusing for parents because oftentimes at this phase in someone's active addiction, family members are estranged from one another. And so to receive a phone call in any capacity, even from the standpoint of, I'm shooting up, I need your help, I need more money deposited into my account. If you don't do it, I'm going to have to sell my body, steal from someone. Family members want to run to the rescue.
So you're saying use your resources, son, daughter, loved one. You've got a whole group of people that is available to you. And you can, even if you don't, you can find them.
Correct.
They're available to you.
Correct.
They're available for free.
They're available for free.
They're available for free to you in any type of community support.
Correct.
So, and this is the detox. And I'm so rooting for you. Click. Phone hangs up.
That's right.
It. Right? No engagement. Mm-hmm. And this is the end of the discussion. And now I'm the parent, right? Or the individual who's worried about my loved one. I have to sit with the feeling. So here's the big elephant in the living room question. Elephant in the living room is PC, right?
It's totally PC.
Yeah, it's not offensive.
Not
right?
at all. No.
Okay. So
elephants in the den. No, that's the problem. Living room's good.
So the question is, they're going to bring up, but what if he dies?
Mm-hmm.
What if he or she dies because I didn't intervene? You're telling me in action, taking care of myself, coping with my terror is the move.
Correct.
Right? And I'm worried, listening to this, that death is a possibility.
It is. I don't believe that family members, and this is where the really scary truth is, I don't believe that they have as much direct influence on whether their loved one makes the decision to die through active addiction. I think that family members can support recovery when their loved one is willing and committed to engage in it, but I don't believe that family members cause their loved one to die through active addiction. Nor
do they. It sounds like you don't also believe that they could cure someone.
Correct.
Nor could you.
Correct.
Nor could I.
That's right.
Right? So there's an agency, a sense of personal responsibility in this discussion that if I'm a patient,
mm-hmm.
if I'm a somebody in recovery, I have a responsibility. Even if Freud comes back, right? Even if I have the great Dr. Freud, I still have to be a participant in the work. And I can't make anybody be a participant in the work.
That's right. And I think individuals who are newly sober, while they want to project getting better onto others, right? Fix me, fix me, fix me. What they're really asking for between the lines is, I want to feel a sense of personal agency and personal responsibility for my life. Let me feel important. Let me feel like I have the capacity to execute change in my life. So it's very confusing, especially for family members.
And especially for family members who are used to being the rescuers.
That's right.
Did you see the movie Beautiful Boy?
I did not, actually.
I thought I didn't need to because I work in the field.
Right.
And I saw it on an airplane. And I really, really, really encourage anyone to see it. And it actually doesn't even have to be about addiction. It could be about any parenting style that involves, I want my kids to have certain things, and I want to pave the way and do it for them and so forth.
Yeah.
And this individual, Steve Carell, was so good. And as he navigates he's so into it. He's doing all the research. He's getting, he knows more about the brain than any provider. He's even experimenting. He's trying to figure out, how we're going to beat this. And his process in the movie, right, that he goes through is one of, just exactly what you're talking about, which is, I can't be in the seat of rescuer anymore.
Right.
That's his detox, right? And I can't, it's ruining my family life because I'm so invested in it. And I think even at a point, right, I recognize that even if I intervene, it's totally possible that my child will die.
Yes.
Even if I'm doing all the heavy lifting. And even if I don't, my child actually may die. And we're going to see that. But I have to model, like you're saying, I have to live my own life. I have to have my own experience of taking care of myself and my discomfort and my terror and my experience. And if I don't, right, I am actually going to keep this alive in such an unhealthy way.
Yes.
Right? So what does the relapse entail?
For family members? Yeah. I think it can start on a very small scale in the form of responding to calamity with urgency, right? Transferring funds over. I've seen family members buy drugs and alcohol for their loved ones, thinking that if I don't, someone else will. They're going to have to sell their bodies to do that. But there are also micro relapses that can take place internally without any action actually taking place. And those come in the form of family members feeling like, if I don't do something, nobody else will. If I don't intervene in some capacity, my loved one might die. I'm the ticket to their life. I'm the ticket to their recovery. The treatment team doesn't know what they're doing. I have to intercept. And so yeah, there's that.
Do you ever get this? You don't understand. I'm a mother.
Right. All the time.
I'm a mother. You're not a mother. Are you a mother?
All the time. All the time.
Right.
I get it all the time.
Right.
And it's the equivalent of, do you have to have had a brain tumor in order to be an effective brain surgeon? Do I have to have walked in your shoes exactly to be able to help you guide your path of healing and wellness? And as a matter of fact, I think in many ways, I have to have not been exactly there.
Sometimes being distant from the scene is actually more helpful.
Correct.
Way more helpful. So what do your workshops look like?
Well, they take many different forms. They really focus heavily on self-care and boundaries, right? And oftentimes family members don't know what it looks like to take a vacation from the scene of the crime. So if I have a couple sitting across from me, a mom and dad, a mom and stepdad, a dad and stepmom, whoever, there's this sense of both panic that I'm not a part of the treatment process anymore. And there's also a sense of excitement and a guilt in feeling excited about what my new life can look like, right? It's almost the sense of survivor's guilt.
So you celebrate that,
Right.
and they're crying about it.
Correct.
Right. So you're like, rah, rah,
Right.
this is great. You guys, you're going to take a nice 2-week vacation despite your homeless child, right? Despite your miserable, bitter situation. You're going to leave it. You're going to trust other people. It's not going to come from you. Your child or your loved one will have to figure it out.
Right.
Go enjoy. You call that self-care? It's a big buzzword.
It
self-care.
is a big buzzword.
I don't love it.
It feels.
I don't love it. I want something else.
Okay.
I want something else. That's just for me. But I'm
Yeah.
saying but we could use it.
Right. Look, we'll use it for the time being because I don't have anything else. My goodness, I need a new bag of tricks. But I think it's really the sense of how do I learn to, and this is your terminology, sit at the table of life, right? Be a human being.
I stole it from Marsha Linehan.
Did you?
Yes.
Okay.
I didn't create it. Yeah, I stole it from her.
Is she at the table of life? I hope she's at the table.
She said it in one of her talks. And
Okay. She goes from table to
I
table.
should always quote the source.
Okay.
I'm sorry.
And that's okay.
Yeah.
So thank you, Marsha. I think family members really deserve a break. They deserve a detox. And it's also absolutely horrifying for them to think that they're abandoning their responsibility. They're abandoning their project.
So you probably can even take it one step further. Just like your son needs treatment or your daughter needs treatment or your loved one needs treatment, you need treatment, right? You need your own treatment. And part of your treatment is living your life. Mm-hmm. And part of living your life is actually modeling that you do not engage in the crisis, right? And there's a message, right, of good parenting, which is when you break contracts and commitments, and you make a unilateral decision, keyword unilateral,
right,
to do whatever you want, it's yours to fix.
Right.
It's not mine.
Right.
Right. And that actually helps you. And to the extent that you trust that I won't clean it up, right? To the extent that you, the loved one, starts to begin to trust that there's no payout in this slot machine, right? You will start actually healing.
Yeah.
So what does healing look like?
Well, for the family system, I encourage them to set 2 primary boundaries. And so I give the example and analogy of QVC or Home Shopping Network. I don't know if you've ever seen a QVC or Home Shopping Network. So I had really bad insomnia in at a certain period of my life. And I would, peruse the different channels. And one of the things that I would run by at like 2 a.m. was a QVC, or Home Shopping Network pitch. And I heard these QVC Home Shopping Network salespeople come to the screen with a sense of tremendous urgency in purchasing the product, right? Mm-hmm. You need this product now. In fact, there's usually a clock.
I get that from Sky Mall.
Right.
When you're 30,000 feet up, Sky Mall seems like the best thing ever.
The best
and then
thing
land,
ever.
You're like, why would I want that?
Yeah. Why do I need that mattress?
Right.
So there's this sense of urgency, and there's also this sense of isolation. So they really appeal to the audience member who's alone, right? Who needs to make this decision to purchase this product in isolation of speaking with anybody else, right? In just themselves. And I think family members are the unfortunate QVC Home Shopping Network viewers at 2 a.m. who feel a tremendous sense of urgency and a tremendous sense of isolation when it comes to responding to the cues of their loved one. So I help them set boundaries of time. I reserve the right to have 24 hours, as an example, before I render a verdict on the decision that you're asking me to make. And I also reserve the right to make this decision in conjunction with members of your treatment team. I will not make this decision alone.
Why do you get a treatment team? I get a treatment team too.
Right.
No is a full sentence.
Correct.
Right. I get to start I don't owe you an explanation. So what happens when parents, this is all very good, just like it's a great idea not to get high, for a drug addict not to get high, they always get high.
Right.
Right. Always is a strong word, but we know that relapse is the road to recovery in the sense that our data suggests that most people per episode don't get clean and sober. If that's the metric you're looking at, you'll be very disappointed. I wouldn't look at that metric. I would look at this as a process.
Yes.
But so you're going to see parents relapse all the time, and they don't successfully model or keep your boundaries. What happens in your work? What do you do with those situations?
Well, it's successive approximation, right? The closer we get to the ideal goal of what healthy boundaries look like, I reward that. And I think it's important to reinforce that. And families are so hard on themselves when they feel like they've fallen off the wagon or that they've quote unquote relapsed.
So there's a value almost in having these quote unquote slips.
Yes.
I'm using quote unquote for slip.
I like it.
Instead of cursing?
Yeah,
Okay.
I'll take it.
All right, but these slips, I guess because it's not a substance, it's not a substance slip, it's a behavior slip. And when that happens, there's no shame in it and there's no guilting. It's more of how can we make this a teaching opportunity? What would you have done differently?
Right.
Right? No beating up. What could you do differently this time? It's a process for your child, loved one.
Right.
It's a process for you.
Right.
And we ask a lot of your child, loved one. We ask a lot. We ask them to be involved in their own treatment. We ask them to take responsibility for their lives and themselves, right? And we ask them to become productive. We ask them to become honorable. We ask them to participate in a way that lends to, increasing self-worth. So if they need all that, you probably need a lot too. So outside of your office, what are you recommending?
I recommend anything from Al-Anon meetings, family anonymous meetings. I think 12-step support for family members is incredibly helpful. And one of the things I hear from family members consistently is, but I just don't relate. I'm from a different socioeconomic bracket. In my community, Al-Anon meetings are for loved ones whose family members are really down and out, are shooting up heroin. My kid only used Xanax. And it's the same process that we see their loved ones engage in when they go to meetings and they feel like they don't connect. So from a modeling standpoint, the act of families walking through that discomfort is really useful for their family members to see.
And by the way, as you say this is a good model for any parent
Yeah.
who's struggling with wanting to rescue, or even in the wake of the college cheating scandal.
Yes.
Right? Delicious.
Yes.
So interesting to me. I don't mean delicious in a gossip way. Fascinating to me how the value system around higher education and what we're willing to do, because it really speaks to a similar issue, even though it's not addiction, is I will do the work for you. I will do whatever it takes. Right? Without you don't even have to do it. Don't worry. Don't worry about the rules. Don't worry about your effort. You can just, don't worry, we got this.
And I would even venture to say that while it might not be traditional addiction, there is certainly an addictive component to that, right? So perhaps had Lori Loughlin and Felicity Huffman gone to an Al-Anon meeting, we might be in a different position.
But you're right, because there's a buy-in piece to this
Right.
that is missing, which is I am hurting someone if I don't give them the dignity of their own experience.
Yes.
Dignity of their own experience. And I rob them of dignity.
Right.
I rob the individual of their own dignity, and I set up a system where I actually create a belief that life will take care of me. Kind of like when you spilled the coffee.
Right.
I sat back
Yeah.
and everybody else did the work.
Right. I thought you just didn't want to bend.
No, I didn't.
Okay.
And I'm used to, if you just step back, everybody else will do it for you.
Right.
Right. Not
I got to
good.
practice that. Okay.
Right. So not good.
Right.
Right. So I have taught myself that I don't have to participate in the cleanup.
Mm-hmm.
Right. So, but it actually robs me of the experience of contributing.
Right.
Silly example, but actually lands the point, which is on any level, whether you're working with in any relationship, right? If you do this for me, if you keep doing this for me, right, then I am actually, it's hurting me.
Yes. When family members rob their children of the experience of failing, they also unknowingly rob their kids of the experience of succeeding. And I think it's really, really vital that family members hear that. And similarly with emotions, right? We can't selectively numb emotions. If you numb from your children the experience of pain and heartache and suffering, you also rob from them the experience of fulfillment and joy and connection and success.
So I want to just wrap up with one thing. In our world, of working in recovery, I do a lot of work in recovery of all sorts. We'll have somebody come in to a treatment center or to an office, and you see them, they go through, right? In that space of early treatment, they are bananas. Bananas, right? It's so dramatic. So whether if they're off of drugs, right, the relationships have high charge, right? There's a lot of spilling and emotionally, and a lot of difficulty sitting still and just doing the next indicated thing type of thing. And we see them a couple years later. They walk in to visit, and I don't recognize them. And physically, when we get them, they don't look distorted physically. We're talking about it a space after they've dealt with medical issues, after they've cleaned up.
Right.
We look at a person and they look like we don't recognize them. Oh, I'm getting a master's degree. Oh, I'm working. Oh, I'm having, I'm getting married. I'm just doing things. I'm just doing regular people things. Nothing like, it's not like they become, nobody comes in saying like, I'm running for president.
Right. Yeah.
Although yet. Right. So what does it look like on the family's end for you a couple years later to be, oh my God, I'm blown away?
Yeah. I think it comes in the form of the system not looking perfect and family members not being so invested in things looking perfect. It comes in the form of family members learning how to tolerate distress and discomfort, implementing skills to be able to engage in regular self-nurturing. Notice how I didn't say self-care.
Yeah, I like it.
Yeah,
I like
self-nurturing.
It's not that it's bad. It's just I hear it so much.
And
I want something else.
Well, and it also, I think, trivializes and undermines the significance of what this is really about. This isn't just about going to take a walk on the beach. This is about learning to forge a sense of personal identity in the absence of utilizing your loved one's addiction or recovery from addiction to modulate emotion.
Heavy lifting. Self-care doesn't sound like the heavy lifting, right? That's maybe my reaction.
Right.
So, and I can sit with that, even knowing death is a possibility.
Yes.
Because what I was doing certainly wasn't the rescue mission.
No.
It wasn't actually preventing anything.
No.
Right. So
except for my own experience in living, my own experience of sitting with the pain and fear and terror of what it might mean to lose you. And I think it's important for children to see that impact as well.
Yeah. This has been very, very interesting, how you work with families to help individuals and families, and what great work you're doing. I love the way you articulate.
Thank you so much.
And it was really, really great having you here.
I'm so honored to be here, and thank you again for doing this work. It's always a privilege to talk about family work, and I'm so humbled and honored to be here, even when I spilled my coffee.
And drop the phone.
Thank you.
Nice. Bye.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room. It is strongly recommended you seek treatment at your nearest emergency room.